Hello, I'm Dr. Michael Walker. I'm a facial plastic surgeon, and today I'm going to demonstrate a silicone lip augmentation on Angelina. She desired fuller lips, especially her upper lip, so we're going to use a filler that's known as a permanent filler, silicone. Silicone has a history of being used for at least 30 or 40 years. However, it received a bad rap back in the 60s and 70s because physicians were using an impure form and sometimes large quantities of silicone. However, in the recent past, a new type of medical grade silicone was developed, which was FDA approved for eye surgery. Now, the eye is a very sensitive organ, and it's very, very reactive to any foreign substances. So if we can use silicone in the eye, it's very safe to use it in the lips as well. So what I'm going to do is inject some silicone into the upper lip first. Angelina has already been numbed up, so she won't feel any of this. We'll prepare her lip here. A little alcohol. All right, we're preparing to inject some silicone into the upper lip in Angelina. We'll thread the needle in deep under the tissue. And then what I'm going to use is called the micro droplet technique, with small pulses of silicone placed in the submucosal border of the lip. What this does, it disperses the silicone in very, very tiny small amounts that the body can easily encapsulate. Silicone is an inert material that the body cannot absorb, so the way it responds to it is by surrounding it with collagen. This collagen slowly fills in around the silicone, and this is what increases the volume of the lip. It takes about 4 to 8 weeks for this to occur. So the immediate effect will not be an enlarged lip. It's a slow process that takes a month or 6 weeks for that process to completely enhance the lip. Using the micro pulses to put in micro droplets in the silicone. Very good. Angelina will go to the other side now. Do the upper lip on this side. Try to maintain the Cupid's bow of the upper lip. The lip has sort of a tongue and groove fit from the upper lip to the lower lip. The upper lip has a bulge that fits into the groove of the lower lip in the central portion. That's not uncommon. Sometimes the patients will have a small amount of bruising after the injection because the needle may transgress through a small blood vessel. But usually it only lasts a couple of days and then it's gone. Occasionally the patient may experience a little bit of redness or swelling in the first 24 to 48 hours. But this resolves rapidly. It's only temporary. I think this is a great alternative to some of the other fillers that we use, such as collagen or Restylane or Fascion, because those temporary fillers will absorb over a period of 2 to 4 months, and the patient has to return for additional injections. This method, it's permanent. It lasts probably longer than 10 years, and we think it may be 20 years or longer, because I've seen patients who've had silicone injections in the 70s with good results, and they've never had to have it re-injected. One of the reasons we have to use a lip filler is because the patient may have been born with thin lips or small lips, but the most common reason is that the patient has lost fat in the lip and it's diminished in size and volume. So we replenish that volume from the lost fat with silicone or collagen. What I'm doing is massaging the lip so that it will distribute that silicone evenly around the tissues. A little bit of bruising, Angelina, on the inside of the lip. There may be a little blood vessel there we got. I think it's going to be okay though. Let me massage the upper lip now. Silicone can be used in other places around the face, although in a very limited fashion. We have used it in the nasolabial folds here and in the marionette lines down here, sometimes in the area around the jaw. I have used it up here in wrinkles in the forehead, between the eyebrows. And it has been used in facial plastic surgery around the nose after, say, a nose job or a rhinoplasty. The patient may develop small divots or little depressions in the nose, and those can be filled in with microdroplet silicone technique. As I mentioned before, this silicone is medical grade. It's FDA approved for eye surgery. However, it can be used off-label, which is permitted by the FDA in other areas. Over 60% of the drugs in the United States that are prescribed are used off-label. Okay, Angelina, how you doing?